I want to take this opportunity to thank the civil society advocacy group for doing the needful to see to it that how best the local partners whose voices could not be heard can now be heard from all spheres, right from their level at district level up to national level.
Yumbe district has a population of 564,000 natives and approximately 300,000 refugees settled in Bidi settlement.
It is not our first time as Yumbe to host these brothers and sisters from South Sudan. Before even we were born, some of us were born in 1950s, our elders hosted these same people in Eringa County by then under Arua. Even the same people have been hosted here in 1997, still when we were still under Arua. And again in 2008, when we are now as a full-fledged district status of our own, and now the current in the Bidi.
Civil Society Budget Advocacy Group, commissioned by CESBAG with support from the Governance, Accountability, Participation and Performance Program, came up with an activity where research was being done in 2 districts. One is Yumbe district, which is hosting the largest refugee settlement in the world. Then the second one is Ajumani.
Some of the key objectives of public financing for refugees in Uganda: assess the funding modalities for addressing the refugee crisis and the existing coordinating mechanisms, analyze budget trends and performance for social sectors at the local government level in relation to the management of refugees, profile the state of service delivery units in the refugee hosting communities, identify challenges faced in the provision of refugee response and propose possible recommendations.
Having this population increase in this short period of time, there is definitely a challenge in terms of service delivery to this community, both now host and refugees. These people, the refugees, are integrated, settled within the host community, where they share the same services, be it schools, water, health units, markets. So there's now a thin line between a refugee and the host community. The number of health units within the district, including private health units, was not even yet enough to serve the population of the indigenous. To the other issue of staffing cuts across. A single nurse in this district will serve like how many population compared to the average ratio of national standard. Underwater sector, before the arrival of refugees, we were one of the worst districts within this country. The safe water coverage within this district was only 30%. Within 5 years, because of several interventions of the different sources, say NUSAF 2, PRDP, normal path from central government, we managed to push from 30% to 45%. We have insufficient service delivery under education sector. Number of classrooms are not enough. People ratio in terms of teachers, very alarming situation. Classrooms inadequate. VIP stands, latrines are not adequate enough. That could be one of the reasons even we are not performing well in our PLE results. As government of Uganda, under the leadership of President Museveni, they're talking about consolidating the past 30 years achievement within this country. But for us as Yumbe, the leadership of Yumbe, we are saying no. Why? Our people have been running around. There was no stability here. This area particularly was a no-go zone. And so we have termed ourselves as the vulnerable community is also hosting another vulnerable community from South Sudan. As leadership of Yumbe in particular, would not agree by the statement of this country that by the 2020, this country should be middle income status. We request, demanding from government of Uganda to have deliberate affirmative action for the people of Yumbe, for us to catch up with that statement. Otherwise, that statement will be a blanket statement.
For the last 3 to 5 years, we have not been getting all of the funds that we planned for as far as our activities are concerned. And this has been as a result of the continuous influx of refugees, and this has been affecting a number of social services, more especially education, and in particular secondary education.
We have not received any attention of central government to increase funding to ensure that we deliver service in relation to challenge that we're mentioning. Out of how much trillion, how much is coming to local governments in terms of what percentage? Those days, the talk was that 15% goes to local governments. If you really go and calculate, we are receiving 9 or 10% of the national budget approved to the local government across the country. And yet we are the service delivery point at that level.
My basic needs as refugees are, one, we have shelter. Then there's education. We have health, in bracket nutrition. We have vocational schools. Those are some of the basic needs that I as refugees we have.
For sure, we need more resources to be mobilized so that it can at least reduce the burden of others, because currently there are those who are going on stress because they don't, the basic needs which are supplied by UNICEF currently is not enough.
Education in BDBD refugee settlement, for instance, in Zone 2, are not all that implemented. The distance of the secondary school very far from the student. There are those children who with the disabilities, and there's no education for them. Our target as a refugee, it is education.
We have to rebrand as the Office of the Prime Minister. We have to rebrand and do things in a different manner. We must engage so many other donors outside the UNHCR funding. We must be very transparent in whatever we are doing. We must be very accountable to the refugees themselves and say the money that we got was this and this is what we did. And in the planning, we must involve all, including the refugees themselves. They must be involved in the planning process such that they are aware of some of these challenges that we get.